The other aspect of assessing the knee is quad mobility, or the rectus femoris mobility, which is the muscle that crosses the hip and knee joint. To assess this, lie on a table with one knee to your chest and slowly lower your leg down. If your leg does not reach parallel, then there is a sign of tightness. If you extend the leg out and there is no change in position, then your hip flexors are tight. If you bend the leg back and the leg rises as minded, that is a sign of rectus femoris length mobility. One way to start is by just foam rolling the area to create a neurological desensitization and to help the muscles relax a little bit. Do this for about maybe 3 to 5 minutes before moving on to the next stretch. This next stretch we'll be doing is the couch stretch. Line your knee up close to the wall as you can, put the other leg out. The key to this is to flex your core muscles and your glutes and not to arch the back. So we're going to move and keep the back nice and straight, and you'll feel the pull in the front of the leg. To get a better stretch, squeeze the glutes and you should feel more tension in the front of the leg. This is incorrect. You do not want to be arching the back. So engage the core and keep the back nice and flat going into the stretch. To get a better stretch, you may also kick into the wall, hold the kick for 7 seconds, and then relax. When you relax, you're able to stretch farther into the stretch. This is a neuromuscular technique that therapists use as well. Make sure to not arch during the exercise. Next, even though not a stretch, we will be actively stretching by getting into a less position and then actively recruiting our hamstrings to bring our foot off the wall. These are considered passive liftoffs and are essential in being able to utilize your new motion that you have just created. Try holding for 2 to 3 seconds and doing it a few times. If you feel a cramp, stop, relax, and then try again. Next, we move to a elevated rear foot split squat. This is essential. As you can see, the leg that is elevated is going through a high knee flexion and hip extension motion, which is giving a good active stretch of the muscles that we just worked on. Once again, this is essential to keeping your mobility.